It's time for our daily dose of cope. And here we have Eaton Spontanelli from the Leopards News Network speaking on the different sightings of leopards eating faces, and there have been some sightings of leopards eating leopards. Let's get into the news for today. I told you there has been sightings of leopards eating leopards. Congressman blindly follows Trump like a puppy he is, disagrees once, now targeted by Trump. Here's the article. Trump targets Texas conservative Chip Roy after tirade on House floor. Donald Trump called for Texas's Republican Representative Chip Roy to be primaried after Roy sided with Democrats and voiced strong opposition to Thursday's failed spending bill. Donald Trump is urging Texans to send someone else to Congress in place of Republican Representative Chip Roy the next time they get a chance. Roy defied Trump's call to raise the debt ceiling and, in a fiery floor speech in the House of Representatives Thursday, said other members of his party who backed the failed spending bill did not have an ounce of self-respect. I am absolutely sickened by a party that campaigns on fiscal responsibility and has the temerity to go forward to the American people and say, you think this is fiscally responsible. It is absolutely ridiculous.
Fact of the matter is, $330 billion. Congratulations, you've added to the debt since you were given the majority again on November 5th. It's embarrassing. It's shameful. Yes, I think this bill is better than it was yesterday on certain respects, but to take this bill yesterday and congratulate yourself because it's shorter in pages, but increases the debt by $5 trillion is asinine. And that's precisely what Republicans are doing. I'm absolutely sickened by a party that campaigns on fiscal responsibility and has the temerity to go forward to the American people and say, you think this is fiscally responsible. It is absolutely ridiculous.
And Vice President Trump says, Chip Roy is just another ambitious guy with no talent. I hope some talented challengers are getting ready in the great state of Texas to go after Chip in the primary. He won't have a chance. Later, he added, Roy was getting in the way, as usual, of having yet another great Republican victory, all for the sake of some cheap publicity for himself. Republican obstructionists have to be done away with. That is what VP Trump is saying of Chip Roy. A few other comments. It's just silly. Politicians need to listen what the king wants, not the voice of the people who elected them. Hapik Reese says, it's tougher when you mistake the king and the court jester Mad Monk for each other. Oh my God, Mad Monk is perfect. Shadow Dragon says, like I keep saying, you elected a king, not a president, but a king. The king keeps his own counsel about what is wise and what is not wise. Bow down and kiss the cock ring or be replaced. Oh, he said, oh man. Okay, this one says, Republican legislator whose party protects and enables for-profit health insurers or healthcare was denied a chest scan by his insurer and forced to wait over a year. Now he has terminal lung cancer and relies on GoFundMe to fund $2 million in medical bills. This is a crazy story and probably could have been solved with the ACA that the Republicans want to get rid of. But let's talk about this story. An insurer denied a CT chest scan. Now a New Jersey dad has terminal lung cancer. The cough began as an annoyance to Brad Schnur, then it wouldn't go away. After seeing several doctors, a specialist ordered a neck and chest scan 3 years ago, but a vendor for Schnur's medical insurance company denied the scan. The doctor appealed. It was denied again. A year later, the 48-year-old father of 3 young children was diagnosed with terminal lung cancer. Schnur believes it would have been caught at a much more treatable stage if the chest scan had been approved. Unfortunately, my story happens countless times a day across New Jersey and all across the country. Schnur, a former legislative official, has become the face of a bipartisan bill that would eliminate pre-approval by insurance companies for medical tests, procedures, and prescription drugs, and leave it in the hands of a patient's doctor. Insurance companies have said the pre-approval process is a way to ensure that providers don't overtest, overprescribe, or charge for unnecessary procedures just to increase their profits. But critics say it's a way for insurers to deny coverage and contribute to massive earnings of $25 billion in 2023 with a 2.2 profit margin and executive compensation packages in the tens of millions. The issue has come to the forefront following the shooting death of United Healthcare CEO Brian Thompson this month on a New York City street. His death unleashed a torrent of criticism at the insurance industry for a litany of issues, especially coverage denial. Luigi Mangione was charged with second-degree murder in the shooting. Shell casings found at the scene had the words deny, defend, and depose written on them, suggesting that Mangione targeted Thompson, police said, over the industry's much criticized role in the healthcare system. Schnurr says he strongly condemns Thompson's murder, but added that the backlash to the insurance industry should set off alarm bells in Washington and elsewhere. A version of the New Jersey bill, S227, has been floating around Trenton since it was first introduced in 2019 without much movement, even though it has two powerful bipartisan sponsors in Senate President Nick Scutari, a Democrat, and Senator John Bramnick, a longtime Republican leader. I'm skipping to the end. It says Schnurr is convinced that the CT scan that was denied a year earlier would have given him a much better chance at survival. Instead, he has retired from his job at the state legislature, where he was most recently communications director for the Senate Republicans. Schnurr estimates that Horizon has received upwards of $2 million in bills for his cancer treatment. And now we have another post that could have been prevented with some affordable health care. This one's titled, "Oh, look, Christian healthcare is a scam." I have never heard of faith-based cost sharing. What is that? All right, so it says that it seemed like an alternative to health insurance until the childbirth bills arrived. So this is a couple. They had something called faith-based cost sharing. Healthcare sharing ministries advertise reimbursements for members' medical bills, but they are largely unregulated and most have restrictions on maternity coverage. Rachel Kaplan was uninsured when she became pregnant last year, so her doctor suggested an alternative, a nonprofit called Sedera, which bills itself as a medical cost-sharing service. Sedera's members pay monthly fees that get pooled together, and the organization can use the collected funds to reimburse members for medical bills. The model is somewhat akin to health insurance, but Sedera isn't subject to the same regulations. It seemed simple enough that we were like, okay, this makes sense, only to find out when I tried to submit the bill from the hospital, we were denied. She and her husband, Andrew Sheffield, reached out to Sedera for reimbursement after their son Lucas was born in August 2023. The delivery had involved an induction, 40 hours of labor, and ultimately a C-section, the kinds of complications that can send hospital bills skyrocketing. But to the couple's shock, they said, Sedera told them they were ineligible, citing a policy near the end of the group's member guidelines. Within the first year of membership, medical bills for childbirth are not shareable. We basically gave Sedera our money and received nothing in return. The rug was pulled from underneath us. Sedera is what's known as a healthcare sharing ministry, one of more than 100 such groups in the United States. Most are rooted in Christianity and emphasize their faith-based value. The model has grown in popularity and revenue in the last decade, as insurance premiums and claim denials have risen alongside healthcare costs, fueling distrust of health insurance companies. And I'm sure that this is going to help fuel some distrust as well. The Alliance of Healthcare Sharing Ministries, a trade association representing 7 large ministries, said that last year an estimated 1 million people in the United States were members of one of these groups. An analysis from the Colorado Division of Insurance put the total at around 1.5 million. Compare that to fewer than 200,000 people before 2010. They are looking for a faith-based alternative to a broken insurance model, said Katie Talento, the Alliance's executive director. They want freedom from being forced to go to certain doctors or facilities. Among the key differences between ministry and health insurance plans are that the latter negotiate directly with medical providers rather than reimbursing members. Most health insurance plans are also required by law to cover various services, including for pre-existing conditions, pregnancy, and preventative care, whereas ministries can restrict coverage as they see fit and have no legal obligation to reimburse members. So you would think that something like affordable health care could work in people's favor. But no, this is where we are because certain groups do not want people to have affordable health care. The ministries operate in broad view of state and federal regulators and got a boost from the Affordable Care Act, which stipulated that people without insurance could avoid fines if they belong to one of these groups. VP Donald Trump's pick to lead the Centers for Disease Control and Prevention, Dr. David Weldon, is a former president of the Alliance of Healthcare Sharing Ministries. This is kind of crazy. One service ministries commonly restrict is maternity care, for which many require a waiting period before a member is eligible to be reimbursed, according to the Government Accountability Office report. An NBC News analyst found that at least 8 of the 10 largest ministries have such restrictions. By contrast, under the ACA, most health insurance plans are required to cover pregnancy and childbirth care as essential services, even if a member becomes pregnant before their coverage starts. NBC News spoke to 4 families who said they were denied or struggled to get reimbursed by their healthcare sharing ministry for pregnancy or childbirth-related expenses. All felt they had been deceived and warned other expecting families not to join, saying that the model can be just as bad, if not worse, than the system they opted out of. 2 of the country's largest healthcare sharing ministries said their restrictions on maternity coverage are designed to prevent people from joining solely to get reimbursed for pregnancy or childbirth costs, then leaving soon after. The members and leaders of most ministries have set some limitations on how early in someone's membership that bills arising from pre-existing conditions or from pregnancy are shareable under their guidelines. Where such limitations exist, they are designed to best steward the resources of the entire member. Flexibility, but with few safeguards. Most healthcare sharing ministries follow a similar model. People pay a monthly membership fee, which varies by policy, but can range from around $85 to $1,300. Members are responsible for an annual unshareable amount of their medical bills, somewhat akin to a deductible, before the ministry will chip in. Members inform their doctor or hospital that they're cash pay patients, which can result in discounted bills, then share copies of bills and proof of payment with their healthcare ministry. In addition to lower monthly payment costs and insurance premiums, the ministries advertise networks with shared religious values that exist outside the mainstream healthcare system. Some outline faith-based philosophies about caring for others when they fall ill. Beyond restricting maternity coverage, many groups' policies state they won't reimburse for prescriptions, routine doctor's visits, contraceptives, or mental health or substance use services. Coverage for medical conditions that predate someone's membership is often excluded as well. And healthcare sharing ministries aren't required by law to limit out-of-pocket costs or maintain large cash reserves to cover members' bills the way insurance companies are. At least 30 states have laws that explicitly exempt healthcare sharing ministries from state insurance rules too. The healthcare sharing entity has full discretion to determine whether or not they are going to pay the claim, and sometimes it just comes down to whether or not they have the money to pay it, said Joanne Volk, co-director of Georgetown University's Center on Health Insurance Reforms, who studies these organizations. That cannot happen with insurance. The lack of regulation comes with some benefits, however. Ministry members have wide latitude to choose their doctors and can easily enroll at any time of the year. For those who get bills reimbursed in a timely manner, the experience can be largely positive. Still, some experts and state regulators say many healthcare sharing ministries promise more than they deliver or take advantage of people seeking affordable coverage, in some cases giving consumers the false impression that they are entitled to reimbursements or are purchasing insurance plans. I wasn't even planning on doing this whole article, but this scam is wild. All right, let me continue. The way they're marketed and designed, many people buy them thinking they're insurance and not realizing what the differences are. As nonprofits, many ministries file publicly accessible finance documents with the IRS. Volk and a colleague analyzed those forms from 6 ministries and found that their reported spending, usually a combination of reimbursements to members and internal operating expenses, often exceeded revenue. This raises questions about the adequacy and stability of funding available to cover members' health care costs, the researchers wrote. They had no mercy for us. Part of Sedera's appeal to Kaplan was joining a supportive community, something she prioritizes in her everyday life. She and Sheffield live outside of Asheville, North Carolina, 2 doors down from Sheffield's parents. Kaplan teaches yoga on Saturdays and is on a first-name basis with the cashier at her local grocery store. The couple owns a small painting company, but they determined that it would be too expensive to get a group insurance plan through the business or to purchase an individual plan. Sedera's $147 monthly fee seemed like the best option. Now the couple blames themselves for not noticing the maternity policy located on page 44 of Sedera's 49-page guidelines, which are available for download on its website. Kaplan says she tried for months to get Sedera to reimburse her delivery costs, which the hospital discounted to around $7,000 without success. It was so stressful. I was crying my eyes out. I was bawling. I was pleading with Sedera. I was calling Sedera every day. They had no mercy for us, no grace at all. The couple has since paid the delivery bill along with around $2,800 for Kaplan's anesthesia, but still owes around $2,500 for a physician's fee. It goes on to say that Sedera and these ministries are not regulated, and that is a big duh. So these people are just basically scammed out of their money. And since these people are palling around with VP Donald Trump, I doubt that there will be any kind of recourse because he doesn't particularly care for regulations anyway. Anyways, have you all heard of this thing, this scam? Let me know in the comments. Join the conversation. Don't forget to like, comment, and share on any of these. I know that we all need this daily dose of cope. So join the conversation.